President Obama, he was smart enough to make sure that this rollout happened after he was reelected. Can you imagine? Romney might have won in a landslide if they had tried to roll this out like a month before the election.
Well, I think that's right, and that's why they pushed it all back. Remember, when the Democrats were designing this thing and ramming it down our throats, Peter, they front-loaded all the halfway decent stuff, like stay on your parents' insurance until you're 26 and pre-existing conditions and all of that. The goodies they front-loaded so that going into 2010, although they lost that election, but going into 2012, certainly people wouldn't have really Obamacare in mind very much. Now, millions of people are feeling the acute and direct pain of socialized medicine, and now it's really starting to hit the fan.
And one of the other goodies that they front-loaded was the higher taxes on the rich that kicked in on investment income and things like that, so they could get some more revenue flowing into the Treasury to make the budget deficit look a little bit less horrific than it was. But, of course, the costs of Obamacare, the exploding costs of medical care and insurance, that dynamic that we've now set into motion, that's not going to explode, until another year or two.
Yeah, well, that's right, but I think you're already starting to see this. You mentioned the higher taxes. They really haven't kicked in yet, but when they do, people are going to be paying higher taxes in addition to paying higher premiums, higher deductibles. People are losing work, they're losing hours, they're losing wages, all of the things you talk about all the time on this program, real economic effects of this that are affecting everybody's day-to-day life. Remember, for Obama and the left, Peter, Obamacare was never about health care or health insurance. They don't give a flying whit whether you have coverage or not. In fact, to your point, they would rather that you pay the fine so that they get added revenue coming into the Treasury. They don't care if you're actually covered or not. Obamacare was always about one thing: government power and control over you. When you look at the history of every socialist and communist state, one of the very first things that they do when they seize power is seize control of the healthcare system for one simple reason. If the government controls your healthcare, the government controls you. This is a massive wealth redistribution scheme by the leftists who are running the show right now. Again, they don't care if you're covered or not. They don't care if you have access. They don't care about affordability. They don't care about any of this. This is a government power grab, and it's a massive redistributionist scheme.
Yeah, and it certainly has nothing to do with insurance, because what they're providing is not insurance. They're actually making real insurance illegal. One of the reasons that there's so many plans that are being canceled is because those plans actually offer legitimate insurance where it only covers major medical disasters, not routine care where, you decide if you want it or if you don't want it. And it's not really that expensive. I mean, you just have to save your money or prioritize. But the government is trying to destroy legitimate insurance and replace it with a government-provided health finance system.
Well, that's exactly right. Look, over the last couple of years, Obama, Biden, Pelosi, Reid, Tom Harkin, Kathleen Sebelius, all of the folks on the left overseeing this monstrosity, they have all been on the record saying that the ultimate goal is to get the country to single payer, that the ultimate goal is to use Obamacare as a way station of sorts, because that was the only thing they could get at the time in 2009 and 2010, use it as a way station to accelerate the country into single payer, which is full-on socialized medicine. That's why now, Peter, you're starting to see Obama and his team trashing the private insurance companies, because it's all designed to kill the private insurance companies and to kill the private insurance market so that they can eliminate all of that and go right to single payer, right to socialized
You're right,
medicine.
And that's, why, it's so dangerous to get in bed with the government, because the insurance companies, basically were working on this, but it's going to backfire because it destroys the concept of insurance, because most people are going to opt not to have insurance. They're simply going to pay the penalty, tax, whatever you want to call it. And in fact, I think what the insurance agency might come up with, some people will come up with insurance for people who are paying the penalties, but they can have some insurance that will cover any gap between the time they get really sick and the time they can enroll in Obamacare. There'll be real demand for that, but the actual insurance industry is going to implode, and you're right, what's going to happen? The government is going to use the failure of Obamacare as a springboard to socialized medicine, which, instead of the public concluding that government is making it worse, this shows us why we need less government and more free market. The government is going to screw up the healthcare system so much by interfering, it's going to then say that, aha, you see, it's so much worse than we thought. Capitalism is so bad, we need to take it over completely. That's going to be the way they do it.
Yes, exactly, Peter, and you're already starting to see this. I didn't think it would happen so fast, 5-6 weeks into this, but it's already happening. Obama and his team are already starting to make the argument that the insurance companies are really bad, right? They're out there with yet another lie, saying your insurance was canceled because the insurance companies pulled the rug out from under you. It's not Obamacare canceling your policy, it's the insurance companies. They're setting this up so that they can say, look, we tried the private route. We tried it with these private insurance companies. We tried the exchanges. Gosh golly, it just didn't work. So now we only have one option because all these people are kind of locked into the system already. They're already dependent on the government and the service. So we only have one choice, and that's to go to single payer. Come with us, won't you? Yeah. And even if you oppose it, Peter, they're still going to ram it down our throats.
The ultimate in ironies, it was such a failure that it was a bigger success than they imagined. They didn't realize that they could destroy the healthcare system so quickly by introducing Obamacare so ineptly. But maybe they will, in fact, be able to do that. And they're already saying this when they talk about the insurance companies. It's always, these evil insurance companies. They have these lousy plans, these substandard plans. I mean, your plans were lousy anyway. They didn't provide real coverage. I mean, they talk as if the people who were buying health care were idiots for buying these plans because the government is telling us that they were lousy plans anyway, and we never should have bought them.
Yeah, and this is classic leftism. And whatever you want to call it, communism, socialism, statism, liberalism, leftism, it doesn't matter. It doesn't even matter what you call it because the consequences are the same. This is this paternalistic view that government knows best. And because government knows best, and not just government, but the elites on the left, because they know best, they're going to confiscate as much of your wealth and your assets as possible to redistribute it because they know best how to do that. And, oh, by the way, you don't know what's best for you in terms of your insurance coverage. We do. And, oh, you're a middle-aged man. Oh, yeah, but we're going to force you to buy maternity coverage because, you've got 80-year-old women who are having to pay for birth control, for God's sake. So this is the way the government on the left operates, and they've had enormous success in doing their class warfare and radical wealth redistribution. And the window is really starting to slam shut in terms of our side that opposes this kind of thing to get in there and really fight.
But, the problem, Monica, is that nobody wants to stand up, when it comes to maternity care and say, why is this even covered by insurance in the first place? I mean, the only thing that you should have insurance-wise for pregnancy is something that might go wrong, like the baby is born premature and it requires a lot of expensive medical treatment, or the baby is born with some other kind of illness. Maybe it's got a bad heart and it needs surgery, something that goes wrong. But if you have a routine pregnancy where you go to the doctor, you deliver your baby, everything is fine, insurance shouldn't even be involved in that process. You should just save your money and pay for it. That's what everybody did before the insurance companies got involved, and it was inexpensive.
Yes, and that should be your choice. This is called freedom, Peter. This is what we talk about, economic freedom. Economic freedom is that every individual, and it goes hand in glove with individual liberty, by the way, each person should be able to decide what is appropriate for them, what they want to spend their own money on and what they don't. And the government, in this case, the left, has taken all those choices away. This is socialism. I mean, people want to say, that's a strong word. What do you think this is? This is socialized medicine.
And the government wants to promise women, in order to get their votes, that you can have as many babies as you want and the government will pay for it, that you should not have to bear the cost of childbirth, that it should be socialized, and other people who maybe aren't even having any children, they should have to pay for, your children. And that's not the case. I mean,
Yes, again, that's radical wealth redistribution. And by the way, on that particular issue about incentivizing women to have as many babies as possible because the insurance is going to be there, the welfare payments are going to be there, that is a reversal of what Bill Clinton did. Remember, Bill Clinton was a centrist Democrat. He was a pragmatist. He worked with Republicans on that kind of reform. He wanted to do the socialized medicine. Hillary did. It failed at the time, but Obama then saw the writing on the wall and decided to work with Republicans and do this kind of reform. Remember that Barack Obama is a completely different ball of wax. This guy is not even a mere radical. This guy is a revolutionary. People need to understand that. He's not your run-of-the-mill Democrat. He is literally doing the fundamental transformation of the nation, which is what he talked about in '08. That's why when we talk about Obamacare, let's not lose the forest for the trees. The trees, the details are very important. All the stuff that we're talking about here about your policy and cancellations and premiums, all very important. But understand that for Obama and the left, the picture is so much bigger than all of that. They don't care about the minutia. They only care about transforming the nation.
Yeah, and also, when it comes to health care, where you have the government, they're able to say that, well, if it wasn't for the government, the people couldn't afford health care, or the poor would be sick, they'd be dying. And they never point out, or no one ever really talks about what health care was like in this country prior to the 1960s, before the government got involved. Everything was fine. The poor were taken care of. In fact, I mentioned on my show yesterday, poor people were flooding to America, for 50 years, and there was no health care at all for them provided by the government. There was no welfare. There were no food stamps. Yet the poorest of the poor from all around the world came to America despite the fact that there was nothing given to them. All they had was freedom, and that's all they needed.
That's all they needed, and frankly, that's all they wanted. And we had families and communities that took care of sick people, and charities and churches and synagogues that did that. Now, however, I'll argue this. When they came out before Obamacare and said, oh, you don't want grandma dying, you don't want to throw her off the cliff, you don't want grandpa eating cat food, you don't want the sick going without care. The counter-argument should have been, and Republicans were afraid of their own shadows to make it, look, we have massive social safety nets in this country already. Nobody goes without care in America. If you walk into a doctor's office, the doctor has the right to turn you away, but I don't know a single doctor who would if you couldn't pay. And if you walked into an emergency room, by law, they had to treat you. Not only that, but we have Medicare for the elderly. We have Medicaid for the poor. Anybody in this country who needed care got treated, period. You didn't need to nationalize one-fifth of the economy in order to solve
and you know what, Monica?
issues.
Before the government overcomplicated the medical industry with insurance companies and malpractice lawsuits, and before doctors were burdened with income taxes and keeping records, doctors spent a lot of their time treating poor people for free. They were happy to do it. They got a lot of satisfaction out of treating the sick for free. But the problem is now, because we've run up the cost of being a doctor, doctors have to spend so much of their time as administrators and paperwork shufflers and tax collectors. Since they have to do so many other things, they don't have all the free time they used to have to treat patients for nothing. We screwed that up. We had so many doctors, and even older people now are forced out of, you have to retire now as a doctor. You can't keep practicing because of the high cost of maintaining your practice and defending and paying your malpractice premiums, that a lot of doctors who would be treating poor people for free can't afford to do it because the system has made it too expensive.
Exactly right. So they've disincentivized doctors from doing it for free. They've disincentivized people from working hard. This is all part of the plan. Again, this is all by design. This is to so weaken the healthcare system that it ultimately does become single payer, and you get the movement toward a real socialist state. And again, people say that that's a strong word, but this is a reality. And unless you're willing to face the reality, you can't fight it. Peter,
yeah.
and
Well,
this
keep on.
Is what it is.
Keep on fighting it, Monica. I know you got to run.